So I'm very happy to have you here with me. A little bit of your background.
Yes. My background is in pre-med. I studied psychobiology at UC Santa Cruz. Okay. And then I went on to pursue graduate studies at Bastyr University, which is a world-renowned leader for natural health.
Beautiful.
I did 2 degrees. One is in naturopathic medicine and the other one is in acupuncture.
Now, you look like you are 25.
Oh, thank you.
The most.
Thank you.
I mean, how long you've been doing this?
I've been in the field of medicine for about 16 years. I started as a phlebotomist in high school.
Oh,
and
that's great.
Yeah, so I've been working with needles for a long time.
Wow.
And since then, I've done various aspects, everything from clinical training to working in hospitals, volunteering, physical therapy, until I finally came across the branch of medicine that really resonated with my heart,
yes,
which is the naturopathic medicine and the acupuncture. Acupuncture is a wonderful healing modality. It can help not only with pain, but also with emotional problems like depression and stress. It can help with any problem that somebody would go see a doctor.
Yes.
It could be even for digestive problems, for problems with sleep, for fertility problems, both for men and for women.
Oh, really?
Yes.
By just having needles?
Yes.
Well, tell me more about it.
From the Chinese perspective, we have meridians or channels of energy in our body.
Yes.
And what happens is that over the years, with trauma, imbalances in the diet, sedentary lifestyle, yes, all kinds of deficiencies, we create blockages of the energy flow in our bodies. So as an acupuncturist, what I do is I facilitate the free flow of energy in the body. So that helps people to overcome many different health challenges. But not only do I use acupuncture as a tool, I look at the whole person. Yes. So I took into account their nutrition, supplementation. I coach them on lifestyle factors such as not smoking, meditating, you know, all kinds of different things that can help them to improve their health. And of course, exercise is one of them.
So it's a body, mind, and spirit.
Absolutely.
It's the whole spectrum,
yes,
that you're working with the person.
And that's what I love about what I do, because it addresses the issue from all these different angles and you get the best results.
And I totally agree. I think one cannot be healed without touching the other ones.
It's
and
all
balancing
related.
Everything. All right, so you came with the needles today, and earlier I had a headache. And just seeing the needles, just like I told you, I was like, I'm about to be healed. And I started to feel better. I mean, that's great. And that was an answer to a question that was a frequently asked question by your patients, yes, which is, do I need to believe it for it to work?
Right. Right. Many people want to know, do I need to believe in it? And I tell them, actually, you don't have to believe in it, because the proof that it works is that it works on animals and children. Yes. And they don't believe in it, and they just have the acupuncture, and the results are so fast, and you can't deny it, you know, and it can't be a placebo effect, because they're not thinking, oh, well, I just had acupuncture, so I should be feeling better.
That's right. That's right. But I would say, anybody can say yes to their healing or no to it.
Right, you could block it, or you could be open to it. Yeah.
I do believe so.
Sure.
And another beautiful stuff that I read about you is that you work also with plants, essential oils.
Yes.
And that is something that you add in your daily practice, or?
Absolutely. I take each case on an individual basis. Okay. So I don't treat conditions, I treat people.
Yes.
So different people have different conditions for different reasons. Or you might have 2 people with the similar factors that created illness, and they might manifest different illnesses. That's right. So each case is individual. And so what I like to do is I match herbal substances, homeopathic remedies, yes, nutritional information, you know, recommendations on what to eat and what not to eat, and I match that with the individual that I'm working with. And for example, a lady came to see me with back pain, and she had already had surgery, she still had pain. Not only did I do the acupuncture to help her reduce the pain, but I went over all of the different factors that contribute to back pain. For example, the high heel shoes that she was wearing, you know, it all starts with your feet, and it translates up.
Yes.
Her chair in her office was not ergonomically set up, so her posture was incorrect.
Was not right.
So then she had to get a special chair. And she started doing yoga and Pilates and strengthening the abdominal muscles. Because if your abdominal muscles are weak, then guess what?
Everything else is.
It's like a pulley system.
Yes.
It's all about balance.
That's right.
So I help people to balance themselves, and we have to look at all of the pieces of the puzzle, not just the acupuncture, not just this supplementation. For example, I used magnesium with her because magnesium is an essential mineral for muscle relaxation.
That's right.
And I used a plant substance called AFA, which is a blue-green algae, and it helps to detoxify the body, because when we're full of toxins, of course we're going to have pain and discomfort and other symptoms.
Yes, and the life that we're living now, I mean, it's all about toxic.
Oh my gosh.
So pain, depression,
Fatigue.
Fatigue. And yes, I agree, those shoes.
Oh yeah, those
shoes.
high heel shoes.
Who's making
Torture.
those shoes? Who do you make those shoes?
Men make those shoes.
Well, you know what? It's so funny, because when I ask my husband, he's like, honey, that's the most ridiculous thing. Men don't like to see those women in those high heels and don't walk right. I'm like, well then,
right.
What
are we doing it for?
Message here.
Right.
So the shoes, eliminate the high heel shoes. Definitely go see somebody and start the work now.
Yes, and nutrition, as you mentioned, pollution is everywhere, not only in the air we breathe, in the environment, in air conditioning, in the carpets. The soil that is used to grow even organic produce is depleted of minerals. So we cannot today achieve the vitamin and nutrient value that we need through our diets, even if you have a perfect diet.
That's right.
Because the soil is depleted. So if you grow a tomato, where does it get the vitamins from? The soil.
That's right.
If that soil is depleted, that tomato is going to have 30% less vitamins. So that means that we have become deficient.
Yes.
And so we need to supplement in order to achieve our optimal health and well-being. And so I target which specific nutrients every individual needs. I can do that with blood work and find out which deficiencies are there.
Yes.
But one of the other things, as we talked about, toxicity is a huge issue, is that we need to remove the obstacles to cure. So I do detox with people, cleanse the liver, cleanse the gut, heavy metals. Once we eliminate that, then we're removing the obstacles to cure, and then we can function optimally again.
That's right. We'll be right back.
Well, homeopathic injection therapy is a relatively new application of natural medicine. What we do is we use the trigger points in the body and inject the homeopathic medicine right into the muscle. And it has an anti-inflammatory.
Is it painful?
You know what? I have a very special technique. Let me tell you. I use a distraction technique. So if I am going to go inject in a certain area, I scratch right next to the area, and then you feel the scratching and you don't feel the needle.
Oh, that's good.
Yeah.
Okay, so right when you, now I know it. Now for me it's gonna hurt because the minute I will feel the scratching, I'm like, oh, that's it, it's coming.
You see, because our brain, we have different kinds of receptors. We have scratch receptors and we have pain receptors. So once I activate the scratch receptors, then it cancels the pain receptors.
Oh, that's good to know.
Yeah.
Oh, I love it.
I have good techniques. People tell me, what, it's already in? You're kidding me. Yeah.
Okay, so you're the one that used that technique.
Yes.
So tell me more.
Okay, so it's great for people, yes. It could be for acute pain or chronic pain. Acute pain means accidents, trauma. If somebody falls and injures themselves, it could be an automobile accident. They have severe pain. It's a wonderful alternative to corticosteroids because unlike the conventional medicine, which is only putting a Band-Aid over the symptom, this holistic medicine actually helps the body to heal from the inside out. And when you do that, a person's vitality is improved. And not only that, but if you take before and after pictures using thermography, you can see before the area is red where there's inflammation. 20 minutes after the injection, it's blue.
Wow.
And it's important for your viewers to know that these medicines are FDA approved. So that means it's recognized to be effective and safe.
Yes.
And it's in the PDR, which is the physician's desk reference, so it's available to all doctors.
Okay, so all doctors, you can just,
most conventional doctors don't know about it, or they don't believe in it, or you know, there's a deeply entrenched relationship between the pharmaceutical companies and the doctors, and so doctors would rather do things that pay better sometimes. That's part of the reason why I didn't go into conventional medicine, is that I felt like it was more profit driven as opposed to patient driven.
That's right.
And here I get to custom tailor solutions to each individual. Even though I do accept many PPO insurances, because I'm not with HMO insurances, they can't dictate to me how I'm going to practice medicine. So I could give each person the best choices for themselves.
I'm so happy to have met you.
Thank you.
I need you. One more thing I would love to talk about is acupuncture and cosmetic.
Yes.
It's used now more and more to lift your face, to tighten your pores.
Right.
So tell me more, because I know you do use acupuncture.
Yes. Acupuncture is excellent for facial rejuvenation. It's a nice, again, safe alternative to Botox and other of the conventional facelift procedures. There's no side effects. You only get side benefits, such as improved sleep, better balance, you have more energy, and it does, just like you said, it helps the body synthesize more collagen and elastin, which naturally slows down with aging.
Yes.
And it's an anti-gravity effect. It does tighten everything and lift it up. Not only does it lift up your skin, but it lifts up your spirit. Acupuncture secretes serotonin from the brain, which is a neurotransmitter that's responsible for feelings of well-being. So it's a natural antidepressant. Yeah.
That's great. So you got those needles.
Yes.
All right. So what are we going to do with those?
Okay. So these are acupuncture needles. As you can see, they're very fine. It's like the breadth of a hair. It's nothing like the needles that are used to draw blood from the arm. And they come in individualized packages. It's sterile, and they're not used on anyone else except for you, and then they're thrown away. And what we do is we put them on different points in the body to have different therapeutic benefits. And we discussed earlier headaches and pain. And the common point for doing that is right here in the web between the index finger and the thumb.
Any hand? I mean,
either hand, yeah.
Okay.
Sometimes if somebody has, let's say, more of a left-sided pain, then we could use the left hand. But I like to treat symmetrically, because sometimes the side of the pain is not the side of the problem. You know, so we have to treat both sides. Even though the symptoms may not be manifesting on the other side, we want to have balance.
Prevent. Okay.
Yeah, so we wanted to do a little demonstration, because another frequently asked question is, does it hurt?
Yes.
And I tell people, it feels like a mosquito bite. You feel like a little tiny little prick, but then any discomfort subsides, and then once the needle's in, it's normal to feel a dull, heavy achiness or a pressure sensation. That means that it's working. That's your chi, or your vital energy.
The energy.
Yes.
It's being lifted.
Yes.
That's great.
Okay, so can we get a close-up on Awa's hand so we can show this? So just relax your hand on your knee.
Okay.
Yeah. Okay. So as you can see, this is a little guide tube, and what I do is I put the needle through the guide tube, and then I just tap it in very gently. Just leave your hand right there and relax it. So I just bring it right here and then tap, and that's it.
That's it?
Easy? No screaming,
no. No, it doesn't hurt at all. I was waiting to see, okay, oh, I can feel good now. Oh, I feel it.
Yeah, usually we leave them in for half an hour.
Okay.
And then at the end of the half an hour, we remove all the needles, and the person has, you could see on their face how relaxed they are. And they leave feeling, they're in a different state. You know, our brain has different wavelengths. There's alpha, beta, gamma, and theta.
Yes.
And there's the waves of relaxation are very close to the waves of sleep. So when you have acupuncture...
So if I fall asleep, it's her fault.
Yes. So actually some people fall asleep during the treatment and even start snoring, you know, because they're so deeply asleep. And when you sleep is when your body heals itself and rejuvenates and replenishes. So,
that's right.
So it's wonderful all around. It's a win-win.
And you are wonderful.
Thank you.
Thank you so much.
My pleasure.
Keep up with the good work.
Thank you.
And come back and visit us.
Pleasure.